Hi, I'm Tom with Dennison Data, here to do a provider ranking system demo and to look up a provider on one of the most common surgeries in the United States of America today. We will be doing heart bypass surgery or coronary artery bypass graft. It is done on about 395,000 people in the year. This operation is done on each year. So I could click on log in if I want to go to the paid website with the most recent 8 years of data from CMS, or without payment or access, I could click on complimentary consumer portal. It's 1 year of data from CMS, a recent year, so it's still useful. We could click on procedure ranking, and we could type in a description. We might have to search through a few different ones to choose from. Let's type in a HCPCS code because we have it already. 33508. Harvest of veins for coronary artery bypass procedure using an endoscopic. In a facility, right now we have it on the entire United States. Let's see how many there are total. So 2,408 providers. We could look in a graph at the top 5 or top 10 providers, depending on what we want to see here. Well, let's go back up to this list. We could say we want to see 2,000 per page. And with that many, we could filter. You could say, well, I remember the last name of the provider, but that's about it. Oh, there he is. Or these columns are all dynamic. You can order them numerically or alphabetically, depending on which one you click on. Green means top 25%. Yellow means top 50%. If there's no highlight, it means they are in the remaining 50%. I'll click on the rank column again. And I'll just go ahead and click on the first one. Oh, before I do that, build average, this last column. You can see here, it ranges quite a bit. So $4,600 and down to a few dollars. So let's go to the top ranking again. Click on NPI code. It'll take us to the provider detail page where it'll show the NPI number of that provider, the provider name and address of their office location. Composite ranking score is found here. 88 is A because 88% does not mean, it's not a grading system like in school. 60 and above is passing, below 60 is failing. This is from 0 to 100. So this means this provider is on the 88th percentile of experience. 88% of providers have less experience in this provider, in this procedure, these procedures. 12% have more experience than this provider for these procedures. In the United States, this provider is number 62 out of 1,264. They're number 2 out of 8 in the local zip 3 722 Little Rock, Arkansas. So zip 3 is the first 3 digits of the zip code. We could have also done the first 2 digits as well. The chart to the right of this is the amount billed and the amount approved by CMS. We could change that to patients and procedures, the amount of procedures done on the amount of patients over the years. Billing and procedure summary for this year, 2018, that we're searching. $687,000 Medicare approved, which is a 5.5% growth compared to the previous year. 2,572,574 was billed by this provider, so 3.74 times higher than what CMS approved. The unique procedure codes, 113, 2,693 procedures on 645 patients did this provider do in the year 2018. Under patient demographics and risk profile, it says whether or not this provider accepts Medicare, Y for yes, and for no, of course. Gender of this provider, RUCA, rural to urban commuting area code, 1 being urban, If you click on this, it'll take you to a page that explains all the different numbers. Type, this is an individual provider, not a group practice. Average age of patients, 74. 34% are female, 93% white, 5% African American. Top 5 comorbid conditions treated by this provider. On our paid website, you can see the top 15 comorbid conditions by providers. Average risk score of patients, 1.4425. 1 would be average, 1.5 and above is high risk. For the same year, 2018, top procedures performed over 10 times per year, or 11 times per year. Green would also be top 25%. Yellow would be top 50%. A good amount of greens and yellows here, ton of green. So that's a great sign, which I guess makes sense. We picked the #1 provider when we were looking at this. You could filter this by keywords or numbers or however you want to do that, or dynamic columns you can click on to rearrange them as well. Explanation of these columns found beneath this listing. And you can see this is actually 2 pages, so we could come up here and say show 50 entries, and that will show them all on 1 page. If I click on any of these rankings, it will take me to a page comparing this provider to their peers, I should say. Whether I click on the ZIP3 or nationally, it will show the comparison there. Well, I'm Tom with Dentist and Data. Thank you for your time. Go to contact us at our website, dentistanddata.com, with any questions, or feel free to email me, tom@dentistanddata.com. Thank you for your time. Hope to see you on another video.